for any signs of swelling at the musculature behind the ear. Any tenderness here?
It's not too bad.
Not too bad, okay. All right. Just gonna have a look at the back of the neck as well. Some underlying rending here right at the joint. Slightly off-centered there. Is that painful for you when you do that?
Yeah, I can feel it right in the shoulder blade and then right here.
Stops about midway. Hello, Hannah.
Hello.
My name is Sarah. It's very nice to meet you.
You as well.
I will be your chiropractic specialist today. So if I could just ask you how you're feeling as a whole today.
I'm feeling okay. Just a little sore in both my shoulders. It's worse on the right than the left.
Okay.
And a little tension in the neck, but mostly the shoulders are what's hurting me.
Mostly the shoulders. Okay. So a lot of what I'll be doing today is kind of some mild manipulation and feeling around with my hands, a lot of palpation. So you'll hear me refer to palpation, and that's just me feeling around.
Okay.
So more so worse on the right side. Now, is that secondary to any kind of injury or just...
So I have been struggling with shoulder tendonitis for years.
Okay.
It flares up. It's really flared right now.
Okay.
And I think it may be partly due to the fact that I have started doing some more strength training and lifting in recent weeks, and it's flared up a little bit.
Got it. Okay, so that definitely makes sense. So I will have a look at that. Yeah, I'm noting maybe just a little bit of misalignment here. Looks like your right shoulder is slightly higher, which may indicate some inflammation. So just to give you a bit of an idea, so what I specialize in really obviously is chiropractic therapy. I kind of err on the side of holistic medicine, so manipulation and kind of teaching your body how to align itself naturally versus any kind of more structural cracking or adjustments, that kind of thing, okay? So just kind of retraining your muscles in a way. So I have a couple different tools that we will be looking at today, and then might follow up for some secondary therapies if necessary, okay?
All right, sounds great.
All right, so I'm just going to start by having an overall look. So if I could just have you sit relaxed in your natural posture here so I can get a bit of a better idea. So just definitely seeing a little lower on that left side there. Are you left or right-handed?
I'm right-handed.
Right-handed, okay. Any pain that radiates up the neck at all?
It more radiates down the arm.
Down the arm, okay. About how far down your arm would you say? Like down to the elbow?
Yeah, like it can go all the way down here through the bicep where it's really tender.
All right. No pain that impedes forward kind of at the clavicle?
No.
Backwards at the shoulder blade?
I mean, that feels a little tender, just tight and sore, but it's not pain per se.
All right. I'm just going to have a look here, looking for any signs of swelling at the musculature behind the ear. Any tenderness here?
It's not too bad.
Not too bad, okay. All right. Just going to have a look at the back of the neck as well. Okay. So I am just slightly concerned here. What I'm seeing just right off the bat before doing any further assessment, definitely some inflammation right at the top of the shoulder. So would you say this is where you're feeling like majority of the pain?
It kind of is there and then down into the front of the shoulder.
So kind of medial between the ligaments tender. Right there. Yeah. Okay.
Like it sort of feels good when you press on it, but it's
just
sore.
A little sore.
Yeah.
Okay. Is it sore parallel in the back here or just more in the front?
It's more in the front.
Okay.
Yeah, like right there.
Yeah, so you're definitely, oh, I feel a little bit of displacement here as well. Okay. All right, so I'm going to go ahead and put a pair of gloves on to start with. I'm going to do a little bit of a deeper palpation there. I'm going to start here at the right side. Now, if I start down towards the inner elbow, tell me on a scale of 1 to 10 what your pain level is here in this area.
So it's interesting. It really only hurts when you start up and come down, not the other way around.
Okay, so upon palpation here, nothing. But if I start the most painful
that's
area.
That's really like a 4.
Okay.
And then kind of goes to like a 3, 2 down there.
Got it. Okay. And nothing really on this side, or just not quite as severe?
It's not quite as severe, but there's definitely some tenderness, especially in the top. So I'd say it's like a 2 up there.
Okay. Just doing some soft manipulation here, feeling for any rigidity, which I do feel just a bit here. The ball of the shoulder, it's a little tight. Are you doing any sort of dynamic stretching or?
I do yoga 3 or 4 times a week.
Okay.
But there's a lot of holding of the poses as opposed to more movement-based stretching.
Got it, okay. Is the pain ever so severe that you have to take any sort of anti-inflammatory, or are you applying any topical ointment or anything?
Yeah, so like yesterday, I actually couldn't even lift my right arm above my shoulders, so I had to take an ibuprofen to reduce the swelling enough to be able to kind of function.
I see, okay.
Other than that, I just do ice. I have an ice ball and I just sort of roll it across the shoulder.
Do you find that either of those remedies help alleviate any of the pain?
They both help. The anti-inflammatory works faster than the ice and rest. So sometimes when I gotta keep moving, I'll just do that.
Got it. Okay. All right. So before I do any further manipulation, I'm going to take a couple of measurements here. I want to get a little bit of a gauge of how severe the swelling is. From what I can see, it's about a grade 2. So just seeing a little bit of pitted edema here at the shoulder. So I'm going to measure first with my just regular measuring tape. I just want to see. It's about 46 centimeters there. How tall are you, Hannah?
5 foot 1 inch.
5'1", okay.
Or 69 inches. I'm not sure how that is in centimeters.
So we're about 23 here from that side. Just going to come across the clavicle here. Slightly off-centered there. So we're only about a ½ centimeter off, which isn't too severe. So I do just want to see. gonna move outward. You've got a little ball of tension right here at the very top of the shoulder. Also present on the left side, but certainly not as severe there. If I could have you shrug your shoulders, very good. Is that painful for you when you do that?
Yeah, I can feel it right in the shoulder blade and then right here.
Okay, you can go ahead and relax there. So I also just want to see, we have quite a few tendons that run up across the side of the neck and then down. So just testing for inflammation that could be starting up closer to the cranium. Have you ever been adjusted by a traditional chiropractor?
Just one time, actually.
How long ago was that?
Oh, years.
Okay.
5 years ago. It was kind of scary.
Yeah, I tend to stay away from traditional adjustments. They can be a little bit abrasive. Obviously, it does help some people, but I try to see if we can mitigate some of the pain with posture adjustments and see if there's any deficiencies that could be leading to a root problem here. Sometimes it's simple as a vitamin deficiency that your body's just not healing adequately. Sometimes it's just repetition and you really do just need to rest. So just getting a good gauge here. I do feel some warmth here. So I'm going to do a couple of temperature checks, just see exactly where the inflammation is lying. But just with my hands, I can feel that we're definitely quite a bit warmer up here. Yeah. Okay. Definitely getting some abnormal temperature readings here at the shoulder. Actually left side as well, but certainly not as severe. A little bit warmer here at the back. Okay, so I am going to palpate around more specifically here. So you're going to feel kind of a circular motion. I'm going to try to isolate this little area of swelling that I feel here at the clavicle. So I'm essentially putting my finger in between the muscles so that I can feel where the tension is coming from. So we'll definitely have a nodule here. Do you feel that?
Mm-hmm. It's pretty tender.
Okay. So having a look at the skin around the surrounding area. Sometimes if there are any signs of erythema or abnormal reddening of the skin, it can indicate an underlying sign of infection within the ligament, but I'm not seeing that here. here right at the joint. Okay. I'm just going to mark this one area with my finger as I continue. And definitely another nodule right here.
That's under too.
Yeah. Okay. So I'm going to check bilaterally here on the left. It is present on the left, but certainly not quite as severe. So I think a lot of it is probably just isolated to the right side, obviously, because it's your dominant. So you're just using it more aggressively, using it more frequently.
Mm-hmm.
Just trying to see if that carries at all. Okay, so I'm going to go ahead and test for any abnormalities in the nerve. So this device is going to, oh, I did see a shift there. Okay. It's going to allow me to see. Okay, so definitely seeing some abnormal fluctuation here. Just going to readjust. And it stops right about there. Oh, another shift right there. Stops about midway. Another shift there. So we've got quite a bit of movement, the nerve endings that lie underneath the surface of the skin. So that'll be something that I'll definitely want to look into. Okay, so I'm going to mark this point here, and I feel a little bit of a jolt. Doesn't really hurt, but it is just kind of a very specific feeling. So just kind of instigating that nerve there, allowing it to release a little bit. So I should feel some manipulation there.
Yeah, that was fine.
Good. Now I'm going to the back side as well. Definitely felt some movement here at the shoulder with that one. And I'm going to hold that pressure slightly down. Okay. Here as well. I just want to see if that changed at all. Okay. Already seeing a bit of relief here. It's about 26 and a half now on the right side. About 22 on